screen with you real quick to go over some data real quick. All right. Sorry about that. All right, so here is our schools webpage. This data hasn't been updated. It will be updated later today. So if you want to check back, but it was last updated a week ago. So currently we have had so far this school year 7,433 total cases, 225 outbreaks. Here's the different districts. Also, we did add the masking and quarantine infographic to the website. So if you want to download it, it's here. It also includes the Spanish version. And this is available also for parents or whoever. So that is that. I don't really have any additional announcements today, except this is our last call until January. Our next call will be the first week back from break, but everybody needs a break. So definitely excited for you guys to have some time off. Hopefully you can get a little bit of rest. So as Matt mentioned last week, we are just going to be doing Q&A this call since we didn't get any in last week. And so we did get some questions by email. So I'm going to run through some of those real quick. But if you put questions in the chat, then we'll try and monitor that, or you can unmute yourself in a minute to ask some questions. So before we do that, let me read some from the email. One of the questions we received was, when will 12 to 15-year-old kids be eligible for their boosters? So I don't know. I'm not sure if Pfizer is looking at eligibility for 12 to 15-year-old boosters. So we haven't heard anything from the federal level about those being available. So if that changes, we'll definitely let you know as quickly as possible. 16 and 17-year-olds can get boosters, and that can happen at any of our county vaccine sites, as well as our school vaccine sites that are happening. We are doing boosters for 16 and 17-year-olds if it's 6 months. Is there any talk of mandating COVID vaccines for students to be in school? There has not been at the county level. I highly doubt that that's happening at the state level. I have no idea at the federal level what's happening, but at the county level, no, we have not discussed that. It sounds like some physicians are telling patients to wait 90 days after testing positive to receive a vaccine. That's possible. We don't know exactly what doctors are telling each patient. However, it is our recommendation to get vaccinated as soon as possible. So we don't want you to get vaccinated while you're in your 10-day isolation period, because that puts your vaccinator and anyone else that you're around at risk of getting COVID. But once that 10-day isolation period is over, you can get vaccinated. Initially, back a year ago now, when vaccines were just rolling out for the first time, they were recommending that that people wait 3 months after infection to get vaccinated. That was mostly due to the shortage of vaccine for everyone. And so now that we don't have the same vaccines shortage, there isn't a need to wait that 3-month period after a positive test. So you can, as soon as you're out of your 10-day isolation period, people can be vaccinated. When will Pima County take over the contact tracing that's handled by the schools? So unfortunately, we will not be taking that over as far as like who is a close contact and all of that. Our staff is extremely small, and we could never do that for all the 360 schools in the county. Currently, our staff, just to kind of give you guys a current standing of our staff on the schools team, We currently have 3 full-time people and 4 pretty part-time people that are kind of borrowed from other programs, that just give us a bit of their time. And so unfortunately, a lot of the part-time people that we have will also be leaving in the next few months. We were hoping to get a nurse in January that could work as a kind of day-to-day contact and support for all the school nurses and all of the health office folks. In January, she was supposed to begin. Unfortunately, she has decided not to come. She lives in Florida, so she decided not to move. And so that will still be happening. We have to hire somebody for that role, but it's not going to unfortunately be happening as quickly as we wanted. So we have a very small team here, and we are not going to be able to do all the contact tracing that the schools can do within their own facilities, unfortunately. Several parents have reported that they are being told that they need a negative COVID test to return to school after testing positive. So that's not the case. Once your 10-day isolation period is over, students can return. If they continue to have symptoms beyond the 10 days, then they need to wait until all symptoms have improved and they are fever-free without the use of reducing medication. And so, but if they are asymptomatic or if their symptoms have all resolved, then they can come back after that 10-day period and they don't have to test negative. The recommendation is actually not to retest within 90 days of an initial positive test. So our recommendation is not to try and like test out of isolation or anything like that. So I know there's some confusion and difficulty around kiddos who come to school with maybe some mild symptoms like a runny nose or a cough. They're being sent home and told that they need a test to return or 10 days. So we wouldn't necessarily encourage a 10-day isolation for kids without a positive test. But it is difficult, especially this time of year when temperatures are cold, flu is going around. There's really high cases of RSV, unfortunately. So there's a lot of different things that kids are going to come into school with different symptoms. So we do recommend testing. I know that it's difficult for the staff at your school to perform a lot of the testing. We do encourage getting self-tests to families, and that actually can happen at all of our library locations in Pima County. Families can pick up boxes of self-tests that have 2 tests in each box. So if somebody wakes up with a runny nose or a sore throat or something like that, they can pick up a box of self-tests as well to help ease the burden on the school staff. Or you guys can also get self-tests to give out to families. But yeah, this is a really difficult time of year because a lot of kids are going to be symptomatic because the symptoms are fairly general. So I think that's all.
I'm sorry. Where did you say they could pick those kits up at?
At the Pima County libraries, at all the public libraries, they are giving out free self-tests, which is great because obviously there's libraries all over town. So, so there's a list also on our webpage as far as places where people can pick up tests. That happens sometimes at our Abrams building and all of that. So all the hours and everything are on our webpage. So I think that's all the questions we've gotten through email. So if anybody wants to unmute themselves and ask any questions, you are welcome to do that. If you're calling in on the phone, you can hit *6 to unmute yourself.
This is Teresa. I just unmuted myself. I hope you can hear me. Yes, I just have I guess a question or maybe some clarification. So we had a student test positive this week, and we're part of the Test to Stay program. So we identified the close contacts, contacted those parents. Those students have been testing, every morning. And long story short, one of our parents who was overly concerned called the health department, did not tell us who she spoke to, but whoever she spoke to, she was told that the entire class should have been quarantined. And so she was upset with the school for not quarantining the class. And I tried to explain to her that we were part of this Test to Stay program and all of that. But I'm not sure, the person who answered the phone probably just did the best that they could, but I'm not sure why she was given that information. And I think, it was, of course, contradictory to what we were doing here at the school. So is there a way that the person who answers the phone can know which schools are Test Stay schools?
Yeah, so absolutely. We have someone who works our school's phone line, and a couple different people are answering that. The difficulty is we have, of course, several phone numbers that people can call to reach people at the health department. I don't know who they spoke to, but yes, we will do our best to disseminate that information to our phone staff to let them know. Thank you, Teresa.
Thank you.
All right, it looks like there's some questions in the chat. Erica's answering about testing. So if anybody else has a question, feel free to unmute yourself.
I have a question for Erica.
Okay, great.
Erica, so this is in regard to the test kits that we currently have, the ones that are expiring. You guys said that those are good till the 18th, is that correct? The ones that are already expired?
Erica, I don't know if you're listening. I know she's in the chat. Hang on just a second.
I have another question I can ask you, Kate, until Erica comes on. So the kids that say they have symptoms and they're on campus and we test them. They don't feel good, but they feel good enough to stay in, but the teachers are sending them because they have like a runny nose. So can we send those kids, they're wearing their masks and go blow your nose, wash your hands. If they're able to stay in class, can they stay in class with a negative COVID test? Or even if they don't, they're feeling well enough to stay in school.
Right.
With the runny nose, right? But with COVID, they're
Right.
here. So if I test them and they're negative, can they stay on campus because they have a negative COVID test? They're having symptoms right now, so you test them now.
Yeah,
or,
so
or
if
should
they're
they go home in case they get tested like in 3 days and they're positive? Does that make sense? Am I being confusing?
Yeah, if they don't have any known exposures, and they are testing negative, like I said, it is a little difficult this time of year because so many kids have different symptoms for things. But yeah, if they're getting tested and they're negative, then they can stay. And also, sorry, I realized I was on mute, but I don't believe Erica is on the call. She's just in the chat. So if you have a question for her, you can pop that in the chat.
Okay.
And Krista, it looks like you have a question.
Hello, everyone. I'm Kat. This is more of an update. So I just wanted to share with all the schools. Hello, my name is Krista Romero Cardenas. I'm the Director of Operations for Premier Medical Group. So we work in parallel and in partnership with Pima County Health Department to provide all the school mobile pop-up clinics. I just wanted to provide an update. Thank you, Kat, for still holding this platform. So in the group chat, my colleague Sarani is going to add the link. I recall a couple weeks back, Brian Eller was, getting all the vaccination clinics set up, and we are hearing from schools that there's still some interest. I know we're going into the holiday season, and we are receiving requests, and I think we're available starting early to mid-January. But I just wanted to reach out to all the schools, provide my contact information. I'll put it in the chat and also the link. So if you or any schools within your district would benefit from having a mobile vaccination clinic come, we can, and we can now provide all vaccines in that location. Previously, it was very Pfizer centric because we wanted to have it be pediatric centric, but now we'd be able to open that. So that link will be popping up in the chat, and I just wanted to share that with everyone here. Thank you and happy holidays. Thank you, Kat.
Thank you, Krista. It looks like Sarani went ahead and put the link to the interest form. So feel free to visit that. It's a Google form. And again, this is just an interest form for a request. Doesn't mean that we can always meet the demand for every single clinic, but fill out that interest form and PMG will be following up with you to get things scheduled. So thank you so much, Krista and Sarani for joining us today. All right, let me see. It looks like there's a couple more questions in the chat, but I think Connie, if you want to go ahead and unmute yourself, you can. Looks like you might have a question.
Yeah, can you hear me?
Yes.
Perfect. I typed this in the chat already, but I'm having a lot of difficulty. I have high schools and elementary school with families, the contact tracers calling the people that I have listed as close contacts and changing their return date, excuse me, not the close contacts, but the positive cases. And then they're giving them a different return date because they will say that their symptom onset was different than what they have initially reported to me. And in high school, that's really important because they figured out that they can change their symptom onset date and come for games or events or winter formals or whatever that is. And so then we get into an argument with the families again about when they can return. And I just would like to ask that the contact tracers that are calling pay close attention to the symptom onset date that we are reporting, because once I make that determination with the parents when that symptom onset date is, we don't change it because, again, kids have figured out that they can change that date and change their return date.
Yeah, that's really great information for us. So I appreciate your feedback, Connie. I know one thing that happens as well, because we've heard this a few times, not this necessarily this exact perspective, but the contact tracers are telling them something different than the school. So a lot of the information that the contact tracers are basing that off of is the actual positivity date, like the test date reported to us by the state. And so sometimes that's different than maybe the test date reported to the school or whatever. So I know that that can vary, but based on the symptom date, that's really great information. So I will definitely pass that on to our EPI team and our contact tracers to see what we can do about, the symptom onset date part of that. So I definitely appreciate that. Thank you so much. Jesusita, go ahead.
Hi, I actually wanted to help with that question that we had for the people that were giving the dates and then having to go back and do that. We were actually having that same issue on our end. So I actually provided the questions that you guys have and essentially tailored them to the people that were exposed. That way they provided me the initial information, and then once I have that, then I submit it to you, because we were coming back with a lot of parents saying, hey, the date was actually this, and they would tell the county something different. So I pretty much got the questionnaires that you guys do, tailored them to the parents, and then have them fill it out, and then they don't come back and say, hey, this is the dates, and I say, well, you know what, this is what you initially filled out. Unfortunately, I'm not able to change anything out because this information has already been submitted, and we're going to go forward with what you initially advised us, because we were having those same issues where we were given different exposure dates or different time frames that their symptoms started, and it was just creating more of an issue on our end, because then we had to put more kids on the list or less kids, and it was just becoming an issue. So as soon as the parents call and notify, hey, they've been exposed or we have a positive, whatever the situation is, we provide them that questionnaire. They fill it out, and that's all we go based off of. And then after that, we submit it to them. So that's how we alleviated that issue there. So it's been going smooth now for the past few months.
Is the questionnaire that you're giving to the parents, is that the like the like the survey that you fill out online when you're submitting a case? Are those the
It's
questions?
just basic. It's just basic questions. When were they exposed? If there was any symptoms, and it's just basic, kind of like the timeline. It's all it is a timeline of what you guys need, and then once they fill it out, then I submit that information. So that way, they initially fill that out, and there's no discrepancies as to what they initially told us versus when they call back 2-3 days later and say, hey, this was incorrect, and or because they need to attend certain events or whatever the situation is.
Yeah, that makes sense. Well, thank you for that tip. That's great. Yeah, to be completely honest, this is something I hadn't thought about, that people are kind of changing their story to be able to attend events, and I'm sure sporting events and things like that. So I appreciate your feedback as I continue to learn the ins and outs and nuances of all the school stuff. So thank you guys. If anybody else has a question, feel free to unmute yourself. We do have about 5 minutes left. And then if there's any questions left in the chat that are unanswered, we'll try and put those in the follow-up email after this call to get those answered for you.
I have a question.
Yeah.
Sita, that form you have, is that something you'd be willing to share with others? So it might help in, like other schools that are having that same issue?
Yeah, hey, Susita, if you want to send that to the school support email address, we are happy to send it out to everybody if you're willing to share that form.
Yeah, absolutely.
Okay, great. Yeah, we'll attach that in the follow-up email as well, and you guys can kind of use that as a template. That's helpful.
Thank you, Jesusita.
Yes, thank you for sharing resources. Looks like Nikki, do you have a question? You feel free to unmute yourself.
I do. I actually have a thanks for being there, Kat, for all of us. And over the next 2 weeks, we have off, and I might have missed the first 5 minutes, but I'm curious how you all are handling the next few weeks while we are off, and what will be done for families that are positive, and how is that being handled? We're really working hard in TUSD to give all our staff a break from doing contact tracing and really take a breather and enjoy the 2 weeks off. Although we do have appointed a couple people to answer calls, and just wondering how we reach out to you and how do we make that happen, and for families to feel at peace during the next couple weeks before we come back and everything goes crazy again.
Right. Yeah. So we will be here. We're working. We'll have a lighter staff than usual, but we will still be here answering the school phone line and email. The only day we may not have any staff is, aside from Christmas Eve and New Year's Eve, we are off those days. There may not be folks here on the 27th, but other than that, for the next couple of weeks, our team will be here and be working.
Terrific. Thank you, Kat.
Yep. All right. Any last questions? We do have a couple more minutes. And also, I I don't know if Anissa, if you have anything specific to share, but
I have another question.
oh, go ahead.
Is there a contact person that we can have to confirm a person's positive status? I have other families that are telling me that that their student has had COVID before. And so they don't want to have to quarantine if they are identified as a close contact. So I've not been able to confirm that a student has had COVID in the past because we don't have it documented or their attendance doesn't reflect that. And I just was wondering, since there is the winter break, if there is anybody that we can use to see if you have any documentation of a person's positive status.
So Anissa, you might be able to speak to this.
Yeah.
We do have like a history of test results. I'm not sure that we can share that information with the school, unfortunately, but go ahead, Anissa.
Yeah, so if you call the school's team number, you can get transferred to one of the EPIs on the school's team. It has to be, we have to figure out a way if it's gonna affect, like, let's say, without actually revealing it, it's kind of tricky how we have to do that because of HIPAA, right? But because it's a public health issue and it can determine whether there's more exposures, like say if this person was positive, say if they tested positive and it was within 90 days of already a case, we could say something like, well, it wouldn't count because it's within 90 days without actually revealing any lab information per se. I can contact the state on how to work around that because obviously there's a necessity to verify if someone's an active case versus a previous case, and that's going to affect a public health investigation. So we can work around that. But if you have these issues, I can talk to Matt and Gretchen and our state health department on how they work around that, and call the school's number, and that's going to be your best thing. I'm getting a lot of calls directly, which unfortunately we don't only do schools. So if I or another staff member isn't able to reach you because we're on another call or doing another investigation, we want to make sure that your questions get addressed as soon as possible. So that school's number is going to be your best resource, and I believe you all should have it. I think it's 724-7018, and you'll get transferred to someone on the team. So just make sure to use that number.
Yes, thank you, Anissa. We have had several team members that got calls from schools directly, and if somebody's out or on a meeting or something like that, then there can be a bigger delay in getting a response to you. So emailing the school support email or calling that school support line are going to be the fastest way to get that information. So thank you, Anissa, for that.
Kat, this is Nikki again from
Yes.
TUSD. Could I ask that once you have that figured out of how to share that information, because you know people are getting smarter and this kind of stuff is happening more and more. So I know we're bound by HIPAA in a lot of ways, but like you said, we're not going to share details. We just want to say yes or no according to Pima County and move forth with keeping the children safe. So if you could give us direction exactly how to go about that, so I can give direction to everybody in TUSD so we can make sure to follow the rules you set up for us.
Yes, absolutely. Yeah, let us work on that process and make sure that we are protecting student information as much as we need to, and also supporting you guys as much as we can. And once we have that process kind of figured out, I will definitely communicate that to all of you. So thank you. And I think we're over time for the day. So I'm going to wrap it up here, but if you do have additional questions, please reach out through phone or email. If there's anything in the chat that's not answered, we'll put that in the follow-up email. But I really, really hope that you guys all can get a break. I know this school year and the last 2 school years have all been exhausting for everyone. And so I hope that in the next couple weeks, you guys can get some time off and enjoy time with your own families and just get a little bit refreshed before the chaos of January. So thank you guys all so much for your incredibly, incredibly hard work for the last few years. We appreciate it so much. And appreciate this partnership with you guys. So have a wonderful holiday season, and we will talk to you all. If not before, we will see you all in January. So thank you guys. Have a great rest of your day.
Thank you.
Thank you, Kat. Merry Christmas. Thank you.